the nonchalance and the inaction from the government and gross negligence on part of the state police made it clear to us that not only the due custody of all criminals involved was of prime importance, it was also necessary to increase vigilance inside hospital campuses and to amputate all elements of corruption within the health system to prevent such brutality against healthcare workers in future. Our initial resistance in form of cease work gained unanimous support from all national and international medical organizations in the common demand of justice and prevention of another such crime at our workplace. In an attempt to pacify the masses at large and to dilute the spirit of the movement, the state government arranged for several meetings with our representatives of WBJDF with verbal promises to meet most of our demands. We returned to work on 21st September 2024, keeping our faith in the administration to fulfill our demands. However, no order or directives were released to gain the confidence of junior doctors, as was directed by the Honorable Supreme Court, and also our emails addressing the state authority requesting the same was also left unanswered. Moreover, false statements claiming revamping of hospital infrastructure and security measures were also made by the Principal Health Secretary, West Bengal, in front of the Honorable Supreme Court. The little that the government of West Bengal did showcase as reformative steps barely scratched the surface of the issues at large and instilled zero confidence in the primary stakeholders. Wounded and dismayed at the tragic state of affairs, while being duty bound to our patients, we also faced further incidents of violence and gross lack of security in other medical colleges across the state, where miscreants even threatened to recreate another Abhoya. Furthermore, even patient relatives were not spared from such violence. There was an incident of skull fracture of a patient relative in a state-run premier medical institute. Even after this, we were met with apathy and inaction from the government, who did not release any of the promised orders, with the Principal Health Secretary stooping to the level of blaming the doctors for non-availability of ICU bed and administrative failures, thereby trying to create a rift between the general mass and the medical professionals. The junior doctors felt that rejoining work without extracting our basic human rights and justified demands would just lead to recurrence of such horrific incidents. Despite this, we kept on working. However, this forced us to escalate our movement to the zenith of all non-violent protest forms, an indefinite hunger strike from the 5th of October 2024. 6 of our colleagues have already fallen gravely ill and had to be shifted to the CCU during this course. Even when we were battling with our lives with the sole intention for justice for Abhoya and prevention of another Abhoya, the state government chose to refrain from interacting with us and to stifle our voices, all of our voices of public dissent, by nefarious autocratic measures, including police atrocities and harassment on the peaceful protesters. Enraged doctors and the general public of the nation and abroad voiced their anguish against the authorities, asking for an ultimatum on behalf of the state government in actualizing our legitimate demands. Junior and senior doctors from both government and private sectors unified and gave a call for a Bengal-wide strike of healthcare services on 22nd October 2024, the sole responsibility of which would lie on the ignorance of the state government. What ensued was a virtual meeting of the Chief Minister of West Bengal on Saturday with WBJDF, with the feathery promise of yet another physical meeting today at 5 p.m. at the State Secretariat for open discussion of our demands. For reiteration, we would like to highlight the summary of our demands, which are aimed at two main objectives: justice for Abhoya and prevention of any other Abhoya in future.
Now coming to our demands, justice for Abhoya. Immediate, sorry for the interruption.
Now coming to our demands. We have demanded justice for Abhoya. Immediate judicial action to ensure that the case does not suffer from undue delays and ensuring that the perpetrators involved in the crime and its cover-up are apprehended swiftly. Our second demand.
No. I'd like to add to that. While this matter is sub judice and the CBI is still investigating, I would add that we are watchful of this, and since there has been a history of delayed investigations by the CBI, we are still looking at their investigation very keenly, and in case there is any discrepancy, we feel that there is any discrepancy, then it would lead to an escalation of the movement from our side.
Our second demand, accountability in health administration. We demanded immediate removal of the health secretary for the administrative failures and for falsely implicating junior doctors as custodians of bed allotment in hospitals, ascribing the incidence of violence in Shagodotto Hospital on 27 September 2024 to medical negligence.
We believe that the principal health secretary who has been in power, while all these corruptions have been taking place in the healthcare system, is responsible either directly or indirectly for whatever has happened, not only to Abhaya but for all the failures, administrative failures, be it providing protection and security to not just doctors or patients, but also the corruptions which are already being investigated by the CBI. Hence, we believe that such a person, while remaining in power, a true reform cannot occur in the healthcare system. We still stand by our demand of removal of post of this person from the chair of the Principal Health Secretary.
Our third demand. We demanded for reform in the referral system, a centralized digital referral system for all hospitals and medical colleges.
And the transport. Second
And we also demanded for our fourth demand, that is transparency in bed vacancies. Immediate establishment of a digital bed vacancy monitor in each institution.
The Chief Secretary of State stated that they have started a pilot project which will be launched very soon. We are waiting for the same. We also have a few inputs regarding the plan of action that I have already formulated for these referral systems and bed vacancies, and we have already provided that to them over email, and we are going to discuss that in details today in the meeting as well, so that they take our inputs, because we feel that our inputs as doctors would help them in this formulation of this plan and proper working and functionality of this plan.
We also demanded for improved safety measures. We demanded the formation of task forces with elected junior doctor representatives to ensure adequate institutional infrastructural reforms to heighten the security measures.
In the Supreme Court, it was represented that a stakeholder committee has been formed at all college levels and institutional levels who are looking into this. I want to highlight that such stakeholder committee formation was not known by all of the protesting junior doctors and even most of the senior doctors. The representatives, the so-called representatives who are part of such committees, are not even themselves aware of such committee existing. They have not taken in any part in decisions making about the infrastructural reforms, which is the key to actual reform in the healthcare system, because we as junior doctors know where the lacunae are, and we are the ones who can highlight and point out what all changes actually need to be done. So we want to highlight that such college level task forces should be immediately formed with elected representatives from not just junior doctors but senior doctors as well, who would highlight these lacunae so that immediate measures can be taken and undertaken, and the security can be established once more in our hospitals.
We have asked for increased police protection, appointment of permanent police personnel in hospitals, replacing the temporary civic volunteers to ensure effective protection of all the healthcare staffs.
Permanent police personnel are not yet being hired in the hospitals. We have also asked for female security personnel, the adequate number of which has not been provided yet. They have been, supposedly the state has formed a SOP for the security measures, and they promised us on 19th of September to hand it over to us. However, a month has passed, yet we have not received that SOP. So we wanted that SOP so that we could provide our own inputs regarding where all we want the security measures to be placed and what all we want, how much of, what kind of security measures we want in place. However, that has not been done yet. Moreover, the permanent personnel recruitment is not being done. they have stated that they will train police security personnel, not police personnel. They will train and hire security personnel and train them for a week, which is not adequate enough, I think, to provide security. Also, the people who are already employed as temporary security personnel have not received their payments, and for a while, lot of them have this notion that why should they work when they are not being even adequately reimbursed for their work. And that is why incidents such as Shagor Datto and Malda Medical College incidents of violence, while this protest has been ongoing, within the last 1 month has taken place.